Hi, my name is Chung Hooi and I'm a master's student from Universiti Kebangsaan, Malaysia, campus Kuala Lumpur. Today I'll be presenting my research project entitled Transcutaneous Vagus Nerve Stimulation Investigation on Cholinergic Anti-Inflammatory Pathway in Rats with Isoprenaline Induced Myocardial Infarction. The main objective of this research is to study the effect of transcutaneous vagus nerve stimulation, TVNS, on macrophage polarization through cholinergic anti-inflammatory pathway in rats with isoprenaline-induced myocardial infarction. The specific objectives include to examine the effect of TVNS on left ventricular contractility of rats with induced myocardial infarction, to examine the effect of TVNS on macrophage phenotype in the injured myocardium, and to examine the effect of TVNS on inflammatory activity and adverse cardiac remodeling in rats with induced myocardial infarction. This is the methodology of my research. On day 1 and day 2, I will induce MI with subcutaneous injection of 85 mg per kg of isoprenaline hydrochloride. And then on day 3, I will withdraw the blood from tail vein and validate MI by performing troponin T ELISA assay. Afterwards, I will start my vagus nerve sham stimulation for 14 days, 1 hour daily at a stimulation intensity of 20 Hz, 0.2 millisecond, 2 milliampere. For vagus nerve stimulation group, the negative terminal will be placed on the tragus and the positive terminal will be placed on auricular margin. Whereas for sham stimulation group, both the positive and negative terminal will be placed on auricular margin. On day 15, prior to sacrificing the rats, I will withdraw the blood again to perform ELISA assay to analyze the inflammatory marker, TNF alpha, IL-1 alpha, IL-1 beta, anti-inflammatory marker, IL-10, and adverse cardiac remodeling marker, MMP9. Afterwards, the first batch of rats, I will use it for Langendorf preparation, and then the subsequent heart will be used for H&E staining and picoserous rate staining. For the second batch of the animal, I will use it for flow cytometry. So for the result of Langendorf preparation is divided into part 1 and part 2. Part 1 investigate the effect of isoprenaline hydrochloride on left ventricular contractility, whereas for part 2, it investigates the effect of TVNS on left ventricular contractility. So the parameter analyzed include left ventricular developed pressure LVDP, which is the difference between the systolic and diastolic pressure, minimum DPTT, which is the minimum rate of LV pressure change, and maximum DPTT, which is the maximum rate of LV pressure change. Minimum DPTT can be an index for cardiac relaxation, whereas for maximum DPTT can be an index for cardiac contractility. So this is the result from part 1. We have shown that isoprenaline hydrochloride injection was able to significantly reduce LV contractility as observed in the reduced LVDP, minimum DPTT, and maximum DPTT. For TVNS significantly improved LV contractility by observing the improved LVDP and max DPTT. The administration of atropine abolished this improvement effect of TVNS as observed in the decreased LVDP and max DPTT. However, atropine administration was able to significantly improve minimum DPTT. As for sham stimulation, it did not show any improvement on all the parameters. So isoprenaline hydrochloride injection was able to deteriorate LV contractility, producing a MI condition characterized by reduced cardiac contractility. TVNS was able to significantly improve LV contractility as observed in increased LVDP and max DPTT. Sham stimulation did not show any improvement, hence showing that the improvement was attributed to stimulation of vagus nerve innervated region. The administration of atropine, which is an anti-cholinergic drug, abolished the improvement of LVDP and max DPTT except for mean DPTT. We postulated that LV contractility improvement exerted by TVNS is attributed to the activation of cholinergic anti-inflammatory pathway. However, further studies are required to investigate the effect of TVNS on cholinergic anti-inflammatory pathway. Thank you.